Hello and welcome to this episode of Health Matters coming to you on Channels Television. Thank you for joining us. I am Mary Alale Yusuf. When couples try unsuccessfully to have a baby for some time, they may be described as infertile. For women, the condition could show up as the inability to get pregnant or the inability to maintain or carry a pregnancy to live birth. Approximately 1/3 of infertility can be traced to the woman. According to the World Health Organization, 1 in every 4 couples in developing countries is affected by infertility, and rates are similar all over the world. On the show with me today is Dr. Chizara Okeke. Dr. Okeke is a reproductive medicine specialist at the Medical ART Center in Lagos.
Thank you.
You're welcome to the program.
Thank you, Mom.
So let's just start by asking, when exactly can you know this is a very sensitive issue. You don't just tell a woman, this is a case of infertility. So how much time must have elapsed before you say, this woman is infertile?
Thank you for your question. I would answer by starting saying that most people will naturally have a strong desire to achieve conception at some point in their lifetime. So understanding normal fertility is very crucial in allowing couples to know when it is the right time to seek help. And it is said that about 85% of couples would achieve pregnancy in their first year of life, and another 7% will do the same in their second year, while about 10 to 15% couples are faced with the challenge of infertility. Therefore, infertility is defined as failure to achieve pregnancy after having a regular unprotected intercourse for about 12 months of living with your husband, and you're not able to achieve pregnancy, then you say that that woman is infertile.
Well, it must be regular, it must be unprotected.
It must be regular and it must be unprotected. And some books say it must happen at least 2 to 3 times per week.
Okay.
For you to turn
apart from the obvious symptoms of a woman not being able to get pregnant, are there any other symptoms that can show that there could be a possibility that she will have this problem?
Not really. It's usually something that is not seen and is called asymptomatic, except when you approach your doctors, your gynecologist, or a reproductive medicine specialist, who can now do a thorough evaluation to know what the cause is. When you live with your husband about 12 months, you've lived under a roof with your husband and you're having regular unprotected intercourse, I think you should seek help. And if you are a woman and you are in your mid-30s, you are 35 years and above, at least after 6 months of living with your husband and nothing seems to be happening, you should seek help.
Okay, so the 1 year is for the younger couples.
Correct.
But once they get older, they should seek help faster.
Very correct. Yeah.
What is the cause of infertility in a woman?
There are varied causes of infertility. But in this day and age, I think I will start with advancing maternal age.
Yes, that is happening a lot now.
Yes, female age-related infertility tends to be the most common cause of infertility today. We find out that when in the 20th century and all that, our parents were in their teens and 20s and they conceived at that point without any problems. But today, women delay childbearing to their 30s, until their 30s and 40s, due to pursuit of education and career. And that tends to, what does it do to you? It tends to lower your ovarian reserve, which is the egg reserve. And for unknown reason, we found out that most research has found out that the egg number and egg quality tends to rapidly decrease as women age.
Let's get this straight. The eggs in a woman, are they all present in her when she's mature, or does she produce eggs with time?
No. A woman is born with a fixed number of eggs from birth. You have some fixed number of eggs you were born with. At birth, there are about 2 million eggs in a woman, but only about 400 to 500 eggs are ovulated in the total lifetime. Before menopause hits. And so it's quite important. Age is an important factor. Reproductive timeline is such an important factor that we need to look in the recent findings, because most of our women, they are in their mid-30s, that's when you start having uterine fibroids, that's when you start having endometriosis, that's when you start having developing uterine structural abnormalities, which can hinder infertility.
So what are some of the other reasons?
Other reasons can be ovulatory disorders. Every woman needs to ovulate to release egg, and then the sperm will meet the egg in the fallopian tubes, and then pregnancy is achieved. But if there are ovulatory disorders, normally the regular menstruation will usually span between 21 to 35 days. And people that have regular menstruation, they tend to ovulate regularly, at least every 2 weeks. 2 weeks after their menstruation, they are likely to ovulate. But in women who have menstrual irregularities, in which the cycle length is now spanning above 35 days, they are unlikely, they might not be ovulating.
But isn't this just a case of the woman understanding her cycle so she can achieve pregnancy, she can conceive?
Yes, women are advised to actually track their calendars. You should keep track on your calendar when your menstruation started, which is your day 1 of the cycle. And so if you want to conceive and you have a regular menstruation, from day 11 to day 16 of your cycle, you should start making effort to meet your husband. You should time it.
But then there are those who have irregular cycles.
Yes, I said it before. A group of women known as polycystic ovarian syndrome women. These women, they tend to have prolonged cycles. Why? Because they may not ovulate every month, or they might not ovulate at all. And what happens in this group of women, they have their follicles remain in arrested position. The follicles will never develop to the required length that will enable it to ovulate. And so these women do not ovulate. And most kind of these women, you find them that they are obese, and they have hairs, a lot of hairs all over their whole body, and they might not be seeing their period. They can see their period every 3 monthly. So this group of women should seek help early